This one.
How about that?
Yeah.
So for the sake of our amazing transcriptionists on the back end, I'm going to keep to my prepared remarks, so I'll mostly not look at you, but I apologize in advance. Happy to chat with everyone afterwards. And I'll just move through, and this will also keep me on track with my 10 minutes. So thank you all for the opportunity to be here with you and present with so many esteemed colleagues in this wonderful community. In my 10 minutes of allotted time, I'll speak about Signal Blocks. It is a public art installation about depression. It serves as the case study for identifying how we can leverage public art for public health. My brief remarks will also cover the core facets of this active approach, including what it is, why it works, and how to deliver on logistics. Leveraging public art for public health is not new, and it's certainly not a novel concept, often arising out of necessity such as a pandemic or a grand event like a breakthrough scientific discovery. But first, for this case, I define public art here as artwork that is accessible to the public in a relatively unrestricted way with unbound means for accessing it. And this includes music, visual and tactile art, theater, literature, poetry, dance, and today, myriad forms of digital media. For public health, I define it in this context as humanity's effort to ensure wellness for large populations while restricting the spread of disease and the dissolution of life. In short, reducing morbidity and mortality, primarily through means of prevention. And so for millennia, humanity has used the arts in service of public health. Here, for descriptive purposes, I'll say that this is an illustration of a biblical text where there's a group of people with spots around them, and there are other figures pointing towards them in gowns and robes, and another person kneeling down. This is a historical example of a biblical reference associated with illustrations from the 5 books of Moses, advocating for the separation of lepers from the larger public. Perhaps a more contemporary means includes the band U2's 1985 London performance to bring awareness and raise money for those impacted by AIDS, and subsequent acts over the last 4 decades through Bono's charity RED, raising funds for AIDS research. Here in this next slide, we see a bathroom stall with a urinal surrounded on either side by wallpaper with male and female condoms, putting them on. So this is the printmaker, Dr. Eric Avery, who was making wallpaper in the 1990s as an act for public health and reducing the spread of STDs, primarily HIV at that time. His wallpaper illustrates how to use male and female condoms. He would travel around to clubs in New York City and get permission to wallpaper their bathrooms with these intentional art actions, as he calls them, making the work accessible to large populations that were likely at higher risk for sexually transmitted disease. Even more recently, a rendition of the historical Rosie the Riveter, and above her head it says "Protect and Respect." There's a Band-Aid on her bicep or delt, and then it says "End the Pandemic." In this case, of course, COVID-19. This is the work out of Los Angeles County, and this was translated into multiple languages and shared across the world. So the public health focus can be informal health education, it can be health advocacy, it can be advancement, or any other directed form. And the key is it's a directed form. Here I want to speak a little bit more about my newest work created in the midst of the COVID-19 pandemic, Signal Blocks, which is a public art piece for public health. While an artist can never know the extent or impact of their work, my intended goals with this work is to reduce stigma around psychiatric health, generate conversations about it, and promote available resources for a general public, including those in crisis. I was comforted this morning when I was going through emails and trying to get ahead of the day to hear on a newscast that today is World Mental Health Day. And the goals of World Mental Health Day, which started in the early to mid-90s, was to do just that, reduce stigma around mental health. And I think in the last 30 years, at least in this country and in many communities, we've been able to achieve some, but not all, of what many of us hope for. So Signal Blocks is a visual and tactile representation. There is a beta form of it, a small look at it in the gallery. And so when I say it's visual and tactile, it means feel free to put your hands on it. So it's a representation of one U.S. veteran's life living with CPTSD, so complex post-traumatic stress disorder, and depression. Each inch of the monochromatic gray painted 2 by 2 inch wood blocks range in height from 0 to 10 inches. Each inch represents the level of depression of where the person was on any given day across the span of a year. The lower the number, the more depressed, the higher, the happier. I guess that goes for substance use too. Alongside the public art are takeaway cards that offer passersby contact numbers for mental health resources and crisis helplines, including for populations considered at higher risk. So this includes military veterans, the LGBTQI+ youth community, among many others. The artwork too serves as a public health effort to add to the dilution of taboos around psychological well-being, allowing for a more egalitarian space where people can gather for moments of contemplation, for conversation, and a genesis of new ideas, alone, by themselves, or in the company of others as they choose. Public art in this nature lends itself to a more egalitarian community space. It is a zone that allows public art to serve a public health mission. That is, in large part, why it works. So barriers to access the art are either deconstructed or they're never erected. And so in modern legal terms, we might call this attribution of Creative Commons license to a type of written creative artwork of this nature. So delivering on the logistics, it's really more a matter of persistence, I've come to find, than know-how. It's first formulating the idea and then executing on creating something others will want or at least find of interest and value. Then it's a matter of ensuring the subject matter experts are inform the associated collateral and content that goes along with these types of works. If the artist, in my case, if I'm not the subject matter expert on that. And so it's a matter of building partnerships and relationships with psychologists, psychiatrists, and social workers as well in this case. And vice versa. If I am the subject matter expert, it's a matter of working with others to get that criticality before launching a piece of public art for public health into the public. I think it's just a good matter of practice and responsibility that I and I think so many other artists in this space take quite seriously. And then we really start building a plan for distribution and taking action. And so I'd be remiss in this moment to not state that the best works are worthless if they're never seen by the public. And so a common anecdotal reason, I suppose there may be some empirical data around this, is that I often hear artists saying that they don't want to deal with the critics. And in the same light, we must also recognize that there are creatives, and there are thinkers, and there are doers who are also going to see that work. And I think all are necessary. Any vulnerability with critics is a consideration I suggest we move past and to embrace, because oftentimes some good will come of that. but to move past it in order to put our works of art into the world in the service of public health. So taking action with clearly guided purpose and a willingness to be adaptable and to iterate upon a work and the associated collateral often serves us well in this space. That's, I think, in part the goal of the critics amongst the thinkers, the doers, and the creatives. And so, public art for public health. I will pause here. I'm probably at my time, and I want to thank you all for the opportunity to be here with you, and I look forward to connecting further.